Welcome everybody to the channel. If you're new, you're welcome. I want to talk about one or two things today. Obviously the BBC have not come knocking on my door. That's one good thing. They say they're going to investigate me, which never happens, of course. Once you get a red letter and all the rest of it, I've not got my any knocks on the door at the moment, which I knew would probably happen anyway. When I was away, I came back and of course got my red letter before I went away and on vacation, kind of a bit of a holiday. But sadly, after I came back off holiday, after a few days back off holiday this week, been a only person I did want to talk about, not the BBC, is my brother, who's very poorly in hospital at the moment with posterior circulation stroke. Posterior circulation stroke. That's caused by, well, a stroke is basically caused by a lot of things, of course. A heart, he's 66 years old, but sadly, it is not too good. But hopefully he can recover. We just don't know. So it's very sad. I'm just praying that he can get better in the next few weeks, So that's what I'm a bit subdued about, sort of talking about. And of course, as you'll see in the thumbnail, please, if you can, stop smoking. It's no good for you. It might be okay now. Young kids seeing this on vaping as well. If you're a young kid of 16, 20 or something like 30s, 40s maybe, But as you get older, it catches up with you. It does catch up with you. I used to smoke. I packed up 20, 30 years ago. I just had operations. I'm still going for bowel cancer, not bowel cancer, bladder cancer. Luckily, I've been caught lucky, but my brother has had a stroke. Causes, obviously, smoking doesn't help in anything, obviously, and alcohol, stuff like that, and lifestyle and everything else. That doesn't help. But sadly, he's in hospital at the moment. And it's a sad thing to sort of have it go through, but to see it, some people having a stroke, heart attack, not nice. So I'm just doing the video basically not about the BBC so much because you can handle them, but when it's family, it's not easy. Because I had to tell my dad today the situation that my brother's in hospital, and my dad didn't know for the last couple of days, and of course he had to tell him. And obviously went to visit him because he's got a bit of dementia. My mother doesn't know. She's in the same situation. We can't tell my mother because she's got dementia. It might cause a lot of problems. And of course, the next few weeks we'll know if he's going to pull through with more therapy and what the diagnosis is going to be. Whether he's going to recover. It may take some time after a stroke. People do recover from a stroke, but this is a posterior circulation stroke. It means it's from your speech, eyesight, balance. It affects part of your body which you can't walk. Maybe you can't walk very well or whatever. But hopefully, with some therapy, you might get something back. We hope so anyway, but it's going to be a big fight we're in. And of course with me, Kato, what are you doing, Kato? With me, I've got a battle with my cancer as well, which is ongoing, but not as much as something like this. At least cancer can kill you, but when you get a stroke, it's not. Well, anybody can have a stroke, but it causes obviously smoking, basically. It doesn't help. So if anybody's out there vaping, you know, vaping and stuff like that, you're a young kid, just pack it up. You know, do something else. You know, do just, you know, why want to sort of put chemicals into your mouth and tobacco and stuff and into your body? And believe you me, if I can pass on this message, because I've seen it in not just my brother's case now, but other people as well. My other brother died recently, you know, a year or so. He had operations and stuff and whatever because of his immune system and stuff like that. A lot of things are caused by smoking. So, you know, not everything, but of course it's not good for you. So anyway, I just wanted to do a video and sort of explain really. We'll try and do some more videos about the BBC, but it's another thing I wanted to talk about. Obviously, my situation is ongoing. Plus, as I said, if you can, just don't vape anymore. Just don't put anything in drugs. You know, it's a drug. Nicotine's a drug, and that's what it is. It can later on in life, like you get into your 40s or 50s, it happens to you. You can get cancer, you can get heart attacks, you can get a lot of other things, you know. So it's not worth it, folks. Please, just pack it all up. Anyway, folks, thanks again. Hope it made somebody stop smoking, and that's the main aim. I'm doing this little video, and of course, just worrying about my brother, of course, that he can pull through or get better. Rehabilitation and stuff like that in time, and it's going to be an ongoing situation, so it's pretty upsetting. But as I said, if you just can, just stop the smoking. Just pack it all up. Just pack it all up and get healthier. You know, do things and stuff, which I've got to do with my condition now. I've got to eat good food and stuff. You know, be sensible with my food and stuff. I've got to lose a bit of weight, stuff like that. So, you know, that's what life's about. Life's precious, and why destroy it by having a cigarette in your mouth and or vaping with chemicals? It's just not on, folks. It's just not worth it. Believe you me, it's not worth it. Anyway, I will see you on the next one. Bye for now. Leave some comments if you are smoking, you're packed up, and there's people out there to help you. Just pack it all up. Just forget about it, pack it all up. It's difficult, but just try and do it.